Thank you very much, sir. Thank you, everyone, once again. While we try to move on to the module one of uh, the skills we are trying to bring in the training, and this is that for us to be able to do this, there is need for us to have some understanding of what psychotrauma is. So we want to build the foundation. I know we all have one understanding or the other, so please kindly just indulge the little we are going to give here. The objectives of this session is mainly to build a strong theoretical and neurobiological understanding of trauma so that it will help to equip us as therapists and to be able to guide our clients with the knowledge to navigate the psychotrauma effectively. And based on this, we hope to see that we can build on this by understanding these general principles of psychotrauma. One, trauma by definition is a deeply distressing experience that overwhelms an individual's ability to cope, often perceived as a threat to life, safety, or emotional well being. This is very important that we be able to appreciate this. And it is based on this that the experts in traumatology believe that trauma is the suffering that follows the event because not everybody that go through trauma that actually suffer from it. And that is why the next sentence is that not every distressing event leads to lasting trauma. The impact depend on individuals' subjective emotional experience. And so that suffering that follows, everybody, many people will be exposed to the trauma, but some may come down with the suffering, some may come down with the pain, and some will not come down with either the suffering of the pain. So this is just trying to tell us that it might not be everybody exposed that will suffer from the consequence of the exposure, but for those that will be, we know they are large, usually large in number, especially when we come to understand the different kind of trauma that we all battle with, like we got exposed to. And this general understanding of trauma is very important for us to see. And what makes it the suffering that follow, as to be clear by, it is based on how the individual perceive it. That this is a threat to my well-being, my life. It is a threat to the safety that I cherish and I want, and the emotional and satisfaction, the emotional balance I'm looking for is challenge, is turbulent. And when all these three are fulfilled, or any of them is fulfilled, it's telling us that the person we are with or in front of us that has come to meet us is suffering likely from trauma. Another thing when it comes to trauma is to be able to understand it that when people who are suffering from trauma, that let's try to understand it from three perspectives. The subjectivity of the trauma, and by this, we mean that the impact is defined by the personal perception, not just the event severity. Two individuals might be exposed to a stray dog, while one will forever be afraid of dog, and we always be in their subconscious, and we hinder them from even trying to do some other activities. Other person might not be. So it is not because of the exposure, but it is the perception that the individual have of it and how the individual judge what the severity it is. And this has been evidenced by the role of subjective response that DSM-5 have emphasized, that the fear, the helplessness feeling that is there help us to be able to understand how the perception is of that event, and the neurobiological understanding of the brain, of how the brain responds to the threat, and that will come to look at briefly along the line. Another thing to look at when it comes to the subject of trauma is the resilience variability. We all have different degree of resilience, and that is telling us that recovery is not a one size fits all. That for people to recover, it doesn't mean that because I've done this, you everybody must recover about the same time. No, people will have their different recovery time. People will have their time to feel that they are able to handle the traumatic process so that before they recover from it. So, and this is influenced by a combination of so many factors: the genetics, the brain chemistry, the experience of prior trauma, that's the adverse childhood experience, The cognitive flexibility that we have based on our childhood experience and our ongoing experiences and how we try to interpret things, and the degree, the level of social support that we enjoy. This is all very important because they all work together to boost or decrease our resilience. While some individuals might experience post-traumatic growth if they are able to have good social support, more cognitive uh, growth. Their prior experience are prepare them to be able to handle future experience, and their brain chemistry have grown deep, that they have what I remember Professor Dofe once told me about stress inoculation. The brain chemistry have grown to that stress inoculation, and the combination of the genetics that they have and all this help them so that they grow and experience post-traumatic growth. Instead of suffering, they rather become more healthy and thrive after the exposure. So the resilience is very important to look so that we don't label everybody that's exposed to the event that they'll be suffering from it. And the cultural context is very important because culture shapes how we understand, how we express, how we are also taught how to recover, how to know that we're recovering from the process, how the healing process is taking place in us. This is very important, and that is why research have come to tell us that in the Nigeria context, we should be culturally attuned to the how the language are being used, especially the way we try to talk in our suffering, giving a spiritual connotation when they are not actually talking about our degree of spirituality, but it's trying to use it as an expression of the psychological suffering we're going through. And it's good that we pay attention to it. And the idiom of distress that we do, that we are thinking too much, we need to be able to express, to be able to know what kind of thinking pattern this individual is having, so that we know we all think. But the whether we think too much, I don't know what exactly that implies. But in the thinking process, we can think in a way that will keep brooding and keep accumulating more and more negative thoughts, or we can think reflectively that help us to be able to uh, look at the process, understand what is happening, learn from it, and this should be able to boost post-traumatic growth. So the thinking too much is a language we use, but if you don't explore it in the cultural context, you may not understand the kind of thinking pattern this person have, whether it's the faulty thinking pattern, the brooding that may lead to depressive challenges or anxiety related, or it might be the reflective pattern that will boost this individual and maybe talking about the resilience of the person and the post-traumatic growth this person is experiencing, that we may not force that this person should be sick. So it's good that we try to remind ourselves of this. This focus of this is not about just to tell us that we need not to forget this when we are talking of trauma. And now let's briefly try to define and classify traumas. One of the first thing that we do, we try to classify trauma generally into three: acute trauma, chronic trauma, or complex trauma. But there are many other different form of trauma that do occur that we don't talk about, but we know we do experience them, and we are going to look them in the form of continuous traumatic stress disorder and intergenerational trauma. So all this we'll look at it. So when it comes to acute trauma, we look at it that this is or the psychological suffering that occur from a single event, whether it's a road traffic accident, armed robbery experience, sudden loss. The characteristics are usually in terms of when the individual come that they experience shock, disbelief, intense fear. The symptoms feel alien to them and is disruptive of the activity. And what the alternative therapy, when we learn it, that if we sit individual on this and we're not able to bring stabilization to the individual, then probably we're not doing ultra brief. If you're not able to do psychoeducation in the effective way, so that to be able to normalize the experience, to bring about better response, reflective response to the abnormal way of looking at the event, of interpreting the event, perhaps we are not doing ultra therapy, because that's what the therapy will help us to do, to refocus it. When we look at the second classification of trauma, we call it chronic trauma, which come from a repeated prolonged stress. Examples include domestic violence, long-term bullying, persistent financial hardships, and these are usually are featured with constant anxiety, emotional exhaustion, hypervigilance, suffering and smiling facade that we are common with. But the therapy we'll be learning will help us to know that in order to overcome this, we need to find a way to sustain rapport. We need to build systematically the hope of the individual so that the individual who is going through chronic stress, who have lost the sense of hope and they have felt defeated, can start rebuilding their sense of hope and recovery in the process. Then the third category of trauma is what's called complex trauma, which the ICD level capture very well. And this talking about a trauma that may occur from early time point in life, which are usually multiple, they are invasive, and this kind of trauma is challenging the way they come. An example might include things like from child abuse, which might be in the form of sexual abuse, physical abuse, emotional abuse, or child neglect, or being born into a conflict like the way the world is going to now. There are many insurgencies that keep going. So all these are part of the causes of traumatic, complex trauma that is occurring. And these are usually characterized by deep seated shame, identity confusion, severe emotional swings, difficulty in relationships formation. And one of the things that the ultra brief therapy bring in order to be able to help address this, if it does occur in individual, is to help to foster wisdom. And that way we're able to practice self-kindness so that the individual will be able to understand that they are not the way they describe themselves or look at that from the common humanity experience that this can happen to anybody, then we can learn to grow and thrive from it because acute trauma can occur in the chronic trauma, complex trauma can occur in the acute trauma can occur in the complex trauma. So all this can intermingle, and that's why it's good to be able to appreciate this. Another form of trauma that is being looked at in recent times is what's called continuous traumatic stress, which are usually from ongoing collective threats. Example include like living in crime infested area or like banditry that were occurring, farmer elders crisis, that any form of traveling becomes comes with anticipatory trauma, uh, and if they are ongoing, they so we are not just only anticipating it, we continue to live it in the moment, and it continue to be the end to end. That's why they are ongoing. And it might also not be due to those that I've mentioned. Political violence are there, and we keep having repeated endless violence. And there can be police brutality that leads to like the case of NSAS that brought its own traumatic impact on the nation. And these are usually some of those things that bring some of those classical signs of PTSD, like hypervigilance, which may one of the things we develop in order to be adaptive to the situation, but become one of those signs and symptoms of the stress, the challenge we're going to. And the symptoms can blend with realistic current fears and anticipatory. And that is why using wisdom coping, not not safety only, help us to be able to deal with continuous traumatic stress. And why we try to focus on practical, in the moment problem solving skills that will also be taught along the line so that you'll be able to handle this kind of trauma. And communal interconnectedness is very important because this helps us with the kind of social support that we build, that will actually build supportive networks, not the draining network that add more to the adversity, that take away all our buffers and make us increase our vulnerability. So, and the third one where we're looking at in terms of type of trauma is intergenerational trauma, which are transmitted across generations. One of the way to look at this, which may help to look at this, that in our examples here as Nigerians, the legacy of the civil war is still there. That make the three major tribes to still be suspicious of one another. And that has brought a lot of distrust, a lot of trouble, because of and that ancestral anger that has been passed from one generation to the other is there. The another example in the Western world is the transatlantic slavery, where the blacks in those Euro American continent keep living with that fear, living with different set of rules in order to survive because of the transatlantic slavery. Uh, Another form of this generation that can be seen in when a mother is pregnant, the mother chooses to use drug of abuse. While the drug of abuse is affecting the mother directly, it's also directly affecting the growing baby, where it go and challenge the gonad of the baby, and that way it has changed the epigenetic nature of the gonads of the growing baby. When the baby grow up, the genetic change has already, and then when the baby give birth to his own child, that will be transmitted to the coming child. So, and that's also another way the intergenerational trauma can come. While the mother is trying to cope with his or her own trauma pregnant, taking drug of abuse, this can also play. And these are seen that have been permeating in the different kind of trauma that we look. And they are characterized by unexplained grief, collective sense of vulnerability, and identification with ancestral suffering. And one of the things that the ultra blue therapy try to look at, it try to help us to be future oriented. And that is why I will try to use hope to separate historical pain from our current experience. And our narrative reframing are very essential. And that's part of what the coping skills we will learn. It will help us to also look about how we interpret our narratives, which will also look the kind of thinking pattern that we do so that we can reframe it the right way and shifting family story from victimhood to resilience and survival. So these are essential, and this help us to be able to see in the context that for any patient or client or individuals that come to seek our help, we should be able to look at what's the type of trauma this person coming to me is going through, and from that way we can be able to understand the person better and try to look at the nuances of it, look at the resilience factor this individual have, what are the cultural way this individual is trying to interpret what is going on, and so that way it will help us when we're applying this treatment, this therapy to the individual. Okay, the next thing is to look at this: when trauma occurs, how did the brain respond to that traumatic event? And the brain try to interpret trauma when it comes in the form of how we try to use this therapy, that which is to target it by looking at it at this level, the what happened in the amygdala of the individual, what happened at the hypothalamic pituitary adrenal axis of the individual. The concept of memory fragmentation comes in, and the kind of story that we tell ourselves when we're trying to respond. Looking at the amygdala activation, and amygdala we all know has been understood as the fear center of the brain, and when they become shrunken, they become hyperactive, and that way they become triggering the fight, the flight, the freeze, or the fawn response. And these are usually what we talk about in our basic physiology when we talk about stress. That when there is stress, when there is what a challenge to the individual survivor, that the individual try to cope with it by either fighting it or running away from it or succumbing to it by freezing and doesn't know what to do. But there's also the fawn response, which is where the individual try to be appeasing to the kind of trauma the person is going through. The fawn response is what we usually see in individuals that are kidnapped, because they just have to do everything to pacify their kidnapper so that they will not go through too much suffering again while they're under that very stressful situation. And the found response make them to become powerless and succumb to everything that face them. So, and that is why it's being recognized as one of those amygdala activation responses that the brain of the individual look at in order for the individual to live with this. I'm sure we'll get this slide later and we can look at the other explanation that are there that will guide us further. The next thing to look at is to look at one of those important pathways in the brain where the part of the brain links with a gland in the brain, and the gland in the brain link with other gland in the body, which we call the hypothalamus pituitary adrenal axis. And this is very well noticed because when it comes to stress hormones, which are related to the stress that we're talking about, that this trauma is add more to the stress that we go through. So this axis is very important in understanding the secretion of hormones that contributes to why we get exhausted or we become hyper vigilant. And looking at it that when this axis is challenged with a trauma, it leads to overproduction of the hormones that are related to this, which are the stress hormone, which leads to elevated cortisol, and this disrupt the normal diurnal cortisol rhythm. There are times the cortisol should go down, up and down, but this time around there's a perpetual rise in this stress hormone. And when this is there, it becomes the second nature of the individual. So the individual is noted with that, and the individual always feel exhausted, become hypervigilant. This physiological effect started manifesting over time, and the psychological impact is also noticed. With the exhaustion is usually noted as fatigue, reduced energy needs, which further become compounded by decreased cognitive functions, and the motivation of the individual is also challenged. Where this when these are challenged, it leads to weakened immune system and is associated with burnout syndrome that we usually talk about among professionals that have white collar jobs, whose form of trauma might be their job, not necessarily that they get exposed to the other form of trauma that people might have. That you might see those executives that work in banks that they have some other executives where they are chair, and with the kind of targets they give them, the kind of harassment they get. So this put those kind of people under this HPA overstimulation, and they usually become more exhaustive, and they also become hypervigilant. The sense of heightened sensitivity is there, so that anything that happens, they become more easily startled, and the anxiety level is always high, and that makes it difficult for them to relax. And you can see part of what they complain about is challenges with their sleep, and this is usually more noticed with the development of PTSD and anxiety disorder. At the physiological level, that as this continues to rise, it continues to challenge the cardiovascular system of the individual and may lead to cardiovascular disease. It also challenges the metabolic system of the individual and may bring about insulin resistance in some individuals. And all this work together, and they can also come lead to compromised immune function. And when these are affected, it can also lead to some easily the individual can become overwhelmed with infection and other challenges, and some other immune related challenges. And with that, all this continue to accelerate the aging process of the individual. And that's why trauma can accelerate the age of the individual, and individual face more challenges at the age they are compared to their peers who are not experiencing similar challenges. And when we look at the psychological impact, and from what I've been explaining, we all know that yes, from this will heighten the depression and anxiety the individual will felt. The cognitive impairment will be there for them, which might come in terms of memory loss, loss of focus, inability to pay attention to things, inability to sustain their attention. When we see that these are the cognitive challenges, and there will be a lot of emotional dysregulation, and emotion is very important, one of the things we need to look at. Because the individual may always be moody, be angry, be fearful, uh, and the individual might be have disgust one thing or the other for one reason or the other. So these emotional challenges are there, and the emotion are not well regulated, and they keep heightening the challenge for the individual. And the more dysregulated they are, the more they push the individual to the edge of the traumatic suffering, and may also lead to some other maladaptive way for the individual to cope, where the individual may start using substance as a way to cope, because the emotional dysregulation is so disturbing, so discomforting, that the individual doesn't understand the emotion he or she is feeling and not be able to deal with it. And that's why I also recommend and ask us that please, for us to be able to effectively understand the emotion, we need to go and learn more about emotion. And one of the animation we can watch that will teach us about emotion basically is the Inside Out, which is an animation one and two. It's good to watch it so that we can learn more about basic emotions, and that we can relate it to our own emotion and relate it to the emotions of the patient that is there, and be able to see how we can help them to overcome this. Uh, Another way the brain reacts to trauma is through the mechanism known as memory fragmentation. And the memory fragmentation is one of those things that occur in individuals that are going through traumatic events, that leads to why it becomes challenging for people to be able to have recall of the event that occurred, and the event become disjointed. So when you ask them, they tend to forget some part of what has happened compared to the, so they're not able to tell the full story of it. And that is what one of the things that some form of therapy usually do, is to help them to be able to tell the story of the therapy, so that that way they'll be able to tell the full story, and that can bring catharsis for them so that they can get well from it. So, and memory fragmentation is one of those things that occur in trauma. And the neurological thing of it is that there is altered activity in the prefrontal cortex, and we know the role the prefrontal cortex play is the executive function of the brain that help us to organize and put this in context, help us to regulate our emotions to some level. And all these are there that when they are challenged, it become problematic. And once they become problematic, they further lead to individual making more mistakes. The judgment becomes more impacted in a negative way, and that keep affecting the individual. And since the memory, the one of the structure in the brain that help with memory storage is the hippocampus, they also get affected, that they start to shrinking. So it becomes more difficult for the individual to recall appropriately the challenge of what has happened. So all this comes together, and people, when they come in their traumatic state, uh, and all with time, you see confusion might come in, distress setting, and a sense of being not real or incomplete comes in. And this is one of those new understanding of what trauma does in the brain, and why this is very important. Because when the memory of the event becomes disjointed, it brings a lot of trouble for the individual. Because the individual is trying not to remember what caused the trouble, so the brain is trying to protect the individual in the process, and that way it leads to the individual not to be able to overcome and process the trauma, so that it can be able to move on towards healing. Another aspect of memory fragmentation is to look at flashback, and these are involuntary, vivid re-experiencing of what has occurred. And this is usually seen as sensory and emotional fragment. They intrude into the consciousness. And this memory fragmentation, that at some point when the individual doesn't know, they just slip back into the person memory, and they come to torture the person more. They come to heighten the already dysregulated emotion in the individual. And that is why it's good for us to be able to appreciate this as one of those things we understand, so that when the person is over, why am I going through this? We can be able to use this theory, this understanding, to be able to help them to understand that, okay, this is why it's difficult for you to recall, and this is why flashback do occur. And when they all occur, they come to stimulate the fear center more, and the individual might start having some visualization of what is happening, and that will also affect the prefrontal cortex that help us to do the executive function of the brain, so that the proper modulation will not occur. And when this occurs, it further subject the individual to more pain, to more suffering. And this can also be worsened when there are acute reminder in the environment. And the brain reacts as if the threat is happening, and if the person start reliving the event all over again. The last aspect that we'll be looking at when it comes to how the brain reacts is the different ways we talk to ourselves, or the people going through trauma talk to themselves, is to look at what we call distorted talk, the thinking pattern, the way the internal messages or the internal discussions that go on in the individual, and the form they occur. And some of them will be looked at from the cognitive perspective, and that will be what the cognitive distortion. And when trauma occur, these are the common way that the kind of story the individual keeps talking or ruminating in him or herself that is leading to the brooding in the individual comes this way. And one of the terminology for that is one called hindsight bias. Hindsight bias is knowing the outcome and the event biases the afterthought. And because we have already decided that this ought to be. So, and that is what the brain have already primed itself that is going to be. So it make it difficult for us to try to think the process through. And when that occurs, it brings about blaming the self for the failure to see what should have been seen and use the clues and signs heralding the event and not preventing it. So this is one of the things that hindsight bias bring. And this is important that we take note of it when we're with the clients. That when we talk with them, they say, okay, I should blame myself for this. I'm guilty for what has happened to me. That if not my fault, I shouldn't find myself in this situation. So this is hindsight bias because the individual has already judged that this outcome occurred and it's my fault that it occurs because I should have known better. And at times, trauma are unpredictable and not things that we know that they are going to occur that will prepare for them, not all the time. Another thinking fault is to discounting the positive. When trauma occurs, the individual tries to ignore early steps taken to survive after the trauma, and the individual started interpreting that, oh, whatever, when this has occurred, since then I've never been myself, I've not been a good person, I've been a weakling, I've been a failure, I'm no longer the kind of person that people respect. So all those kind of negative talk, the discounting that come to the individual, that every little positive that occur, the individual cannot see it, but rather dwell more on the negative that is coming. So an individual refuse to count the positive, the good that occur every day in their life and cannot see it. Another thinking fault that occur in trauma is emotional reasoning, where the individual look at the his emotion as the fact or evidence of the truth, and this is because of the emotion attributed to it that the individual is looking as if that is the fact. When something happen, we all feel bad, and that is normal to feel bad. Or we can all feel angry at some event. That is normal to feel angry. But because we felt that does not mean that we're a bad person. But when we try to think based only on the emotions alone, then it can lead to the emotional thinking, the emotional reasoning that happen. And the example there is that because something bad had happened to me, I must be bad. Or because I feel bad, I must have done something bad. I remember in this one of the emotional I've encountered in one of the patients is uh, a lady that used substance and blame herself for using the substance because in childhood she was raped and she kept using emotional reasoning to address the issue. That is because I'm a slut. It's because I didn't play my role enough to protect myself. Otherwise, I should not have been raped. And when this traumatic thing come, one of the things she takes to in order to deal with it is to use drug of abuse. So this emotional reasoning is there. It is there for the individual, forgetting that she's not to be blamed. She's a child who needs to be protected, and the people that raped her are adults who should have protected her, but they take advantage of her childhood, and they use that and they blame her so that she now carry the blame and the guilt feeling with it. So emotional reasoning is one of the things that can occur because of trauma. And another way that cognitive challenges come when there is individual is going through trauma is the kind of way we label what is happening, the kind of name we give to it, the kind of tag we give to it. And this usually come with a negative tag, with a depreciative tag, with a self-depreciating labels, and that may be I'm broken, I'm unlovable, and that can be troubling. And that can also be for people who might be going through trauma, they can also go to the extreme of it, where they say people tell love yourself, and instead of them to realize that they start labeling themselves that I'm the best, and that can lead to kind of narcissistic thinking, that they started injuring others, started disrespecting the right of others because the kind of label they give to themselves after that. So that is why the labeling is very important, that we look at it, and how the individual interprets it is very important, so that we can be able to help the individual to overcome the trauma thinking that the person have. Another traumatic story people can that can be on look at is what they call the degree of responsibility, which can include ignoring others' responsibility, especially that of the perpetrator. Even though example is not provided there, but we can look at it, and that is what the fawning aspect. If you look at earlier when we talk about the responses from the hypothalamic pituitary adrenal axis, the individual can respond with fight, flight, or freeze. But the founding response is there. And the founding response is where the individual will start ignoring that this person who is responsible for this trauma, who is the perpetrator, should be held responsible. But rather, the individual will start blaming himself for what has happened. And that may also follow the story I've talked about, that individual that was raped in childhood and is taking all the responsibility, that it's my fault if I had not dressed in a way that I felt exposed. As a child, the child doesn't know what is exposed or not. It's the adult that know, and it's the adult that take advantage. But the person take that responsibility on himself and is giving excuses for the perpetrator to go scot-free. And the last one we'll be looking at is what we call the all or nothing thinking. I want to believe we are familiar with this. And this is some of the thinking that people are. It doesn't mean that one event might come with all this thinking pattern or some of this thinking pattern, or it might bring only one of them up. But it's our responsibility when we are trying to understand the trauma that people are going through to be able to tease this out, so that when we can bring this out, it will be helpful for us to be able to help them to be able to overcome the trauma. And an example here is that no one can be trusted, or I will never be safe, or I'm to blame. The world is unsafe. And when we come to this, it really make living difficult, and it make the self blame, the self suffering, the self punishment keep going on, and the self judgment keep rising, and it continue to weaken us and continue to increase our suffering in the world. What is the summary of all this thinking pattern that we are trying to do? And that is what this model is trying to do, which is the model that this therapy is based upon. This model try to tell us that when we want when we're developing the psychotraumatic pain, this is the way it goes, and it leads to the suffering. When the traumatic event occur, if you look at it at this level, when the traumatic event occur, you can see it here. When the traumatic event occur, what does it do? It can go through the way we think, or it can go through our emotional reaction. And when it goes through the way we think, which is what we can say the traumatic thought, our memories, the cues, it can lead for us. Those memories can be grouped into two: the SAMs and the VAMs. The SAMs are the situationally available memories, and the VAM are the verbally accessible memories. So these are very important for us to look, because the memory that will come in these two ways: as a result of the situations, or as a result of the talk which cue it. Whether we hear something, the situation, whether somebody whispers something, we hear it, the verbal, the intonation. And when this occur, what does it try to bring about cues that compromise our sensories, our physiological, and our motor responses. The sensory are affected through imageries, flashback, nightmares, which we have discussed in the previous slides. And when we look at physiological response, we have also talked about emotional dysregulation, which may come in form of numbing, palpitation that people might talk about. And when we look at motoric, which are what our behavior that we do, which can come out avoidance behavior, hypervigilance, and all those things that do occur in the process. Then, if you look at the verbally accessible memories, these are these are the verbally accessible memories sorry for the little distraction, are something that occur from the recall, and they can be detached or narrowed. And when this occur, they affect our sensory response, because when we see things visually, it bring about the way we respond to it. And the imageries, and when all this occur together, what they do is that they affect our emotional relieving of it. And when we relieve it, it brings some emotions in us. And this is what these theorists have tried to look at. This is what this theory have tried to look at. The emotional relieving that occur, that the way we relieve the emotions of the suffering, can come in the form of guilt, shame, sadness, self-blame, which are here. And the cue that come from the situation that we see can bring come in two ways: bring about some emotion for us in terms of fear, anxiety, anger. Or it can come also to come about conditioned emotions that come occur, which are what in terms of fear, anger, and anxiety. So when we look at the other side of it, emotion itself can be grouped into two: our emotional reaction. It can be about conditioned emotions or derived emotions. And the conditioned emotions are what we expected when this happen. That because of this condition, then this is the emotion that should come about. So when this happen, we should be fearful. That occurs. When this come, we should be having anxiousness, and we should be angry with the situation. So that can come. But with time, we can also derive this kind of emotion, that when this come, we can relate it to other things, and those are derived. And those derived emotions are usually negative emotions by the secondary event that has occurred, which are activated by the meaning of the event and the consequences or implications of the event. And they can be established by pre-existing belief and expectations that generates them. And that is why this try to summarize the what happened in the amygdala, what happened in the HPA axis, uh, what happened with our memory fragmentation, and what happened with uh, the memory fragmentations, and uh, the stress response that we go through. So uh, all this try to summarize the process for us, so that it help us to be able to appreciate that when there is a trauma developing, the traumatic event, when it's gone, it leave us with thoughts, and it leave us with feelings. And when those feelings are there, the feelings might be what is expected at that time, but when they persist, then they bring more about the suffering. And these feelings might be derived as a result of our prior experience, that when this is where I want to deal with it, and that may perpetuate it. And our thought will come into it. And when the thoughts come in terms of the situation, as we cue it, it might bring about the conditioned emotions to related to it. And when it come about the voices, the verbal responses associated with it, it might bring about the derived emotion that's there. So this help us to link the all mechanism that we have tried to talk about in this process. So these are the summary of it in terms of the what happened in the brain, what happened in the hormonal level, and what happened in the memory, and what happened in the story that the individual or we talk to ourselves in trauma. This will be the last aspect of what we'll be discussing, and hopefully, so that we will now go to what is the questions and answers, and we'll rub minds before we go wait for Saturday for the next session. The cultural manifestation of trauma is very important, and these are very important for us not to gloss over it when we are with people that are going through traumatic suffering. Trauma in Nigeria is shaped by unique social, historical, and spiritual context. The This can be seen in terms of communal trauma that happen. This can be seen in terms of clashes, terrorist attack, insurgencies, kidnapping, and the rest, all bunkering problems, challenges like that. And these are very important for us not to forget that when there are communal clashes, the survivor of those clashes go through a lot if they don't have post-traumatic group for it. And an example would be, let's say somebody from a Jos riot and reported that is collective grief. And when this occur, it is important for us to see this person grief. Is he interpreting only in terms of his own experience, or is he interpreting the grief in terms of what is happening in the community, or in terms of the several people that be affected in the community? This is very important for us to be able to, and looking at how the individual is interpreting this in the community he or she is also important. And in Nigeria, where we live collectivistic lifestyle, how the community interpret and dictate and guide us to do it is very important for us to learn it from the experience of the person going through trauma, because that will make it better and easier for us to be able to use this therapy to address what the person is going through. And if we should use it in a group intervention, it helps us to be able to do it better, and for the individual to be able to, for the group to be able to share their experiences and be able to share their resilience in the process, so that it can be effective for them. Another form of way we can look at the cultural manifestation of trauma is the post-conflict stress. And when we look at crisis, let's say like Niger Delta or ongoing militancy, creates chronic stress. For instance, the stay at home, that people should not go to work on some days of the week. This is so repetitive, and it can bring a lot of trouble. And when this continue, it continues to create more trouble. And it's good for us to be able to see what is the cultural interpretation of what is happening there, and that way it will help us to be able to deal with it. And that way we can look at one of those sayings that say, when one person's story is told, the community heals. And that is if you can hear the person of the story of the person talking, and the group is listening to the person, the therapist is listening, and is trying to help them that, look, your story is the story of everybody, which is our common humanity. It is this, and when we can help you, that means we can help the community. And it's good for us to be able to understand it from the community aspect of how the person is telling the story. So the conflict is not just about what has happened. The conflict is about how the person who is a member of the community is suffering, as a way is interpreting how the community is suffering too. And also importantly is the spiritual interpretations we give to trauma in our community, because many of us attribute trauma to spiritual causes, just like it's a cause or an ancestral issues. And this is very important. When we look at our Nollywood, the Nollywood interpret trauma, interpret suffering in spiritual terms. And that is the traditional, the the Nigeria ancestry knowledge of trying to interpret, give meaning to the traditional medicine practice. It doesn't necessarily say that this is a spiritual problem, but the terms that maybe perhaps are available then, the language, use of language that are available there, are usually understood more in terms of spiritual interpretation. So when all these are what the person uses, for us to be able to help the person reframe it the right way. If you can't help the person to reframe it, then the person will not be able to overcome that. The spirituality is different from spiritual interpretation that the people are giving. And it's for us to be able to provide the right context, the right understanding, and the right approach, so that the individual can be able to understand that trauma as not a spiritual attack, but something that can be addressed by looking at their psychological wholeness, looking at their physiological wholeness, and looking at their brain structures that is happening there. And they can be helped still in the context of their faith, that their hope can be enhanced, and their faith is also about hope. And this can help to bring about integration rather than conflict in the process of trying to help the individual. So it's good for us to be able to understand these cultural nuances in order to be able to help to understand the what trauma is, its manifestation, and how it looks like in our context. I will stop here to thank you for your patience, and see for the few remaining minutes if there are things we may be able to discuss together. We are all talking together and sharing. Thank you very much. Prof. Sir, thank you very much, sir.
Yeah, thank you very much, Tajuddin, for a good expose, a beautiful presentation. Yeah. And also thank you for all of us for listening. Uh, Maybe I should let us know why this process is so important for us. Many of us who are participating in this are resident doctors and consultants. There's no choice. Once you are in a group, you'll be a medical group, you'll be required to act as a leader in this group. So by the time we finish the training and you are participating in one or two extra trainings, you'll be required to be a trainer. And it's not just to, you remember Tajiri had mentioned that even people with background of secondary school are capable of being trained to carry out this intervention. Who is going to train them to carry out this intervention? You are the ones. So it's important to understand the basis for the behavior, the basis for what people see and have, and basis for how they feel, the basis for how they think in traumatic situations. That's why he has taken out time to go step by step so we all would understand this and would be required to show evidence of this understanding while we're doing our post test and things. So, we would, if there are any questions, we'll discuss. But what I'm really pushing is please try create time before the next lecture to understand the different things. These are things we've all heard before. Many of us who are psychiatrists and senior registrars and things have heard of all this before. Even the junior residents have also heard of this. So it's not just hearing, it's to know them so that during training, during therapy, you can recognize them. Because once you can recognize them, it gives you feedback that is positive in being able to help the person because you understand the thought pattern. I don't know whether I should call it thought disorder. You understand the pattern of the thought. You understand the what do you call the imageries and how they come up. You understand the psychopathology that is being discussed mentioned by the patient. So it's important not just to hear and think you've known it, but to thumb through it and read through and be sure of it so that when you are explaining to the people who will be required to teach, you would know exactly what it's all about. So thanks